California removes 900,000 people from healthcare plan. A staggering 900,000 Californians have been stripped of their healthcare coverage, raising serious concerns about the future of healthcare access in the state. According to data from the Kaiser Family Foundation, KFF, a leading nonprofit health policy research and news organization, this massive disenrollment from Medicaid has occurred over the past 2 years as part of a nationwide trend following the expansion of Medicaid coverage during the COVID-19 pandemic. But here's where it gets controversial. The removal of so many individuals from Medicaid is not just a numbers game. It has real, tangible consequences for the health and well-being of those affected. Newsweek reached out to the California Department of Public Health for comment, but has not yet received a response. Why it matters. The unwinding process, which began in March 2023, has led to significant drops in Medicaid enrollment across the United States. This trend is particularly alarming because it means more people are going without health insurance, which can lead to worse health outcomes, increased strain on emergency services, and higher medical costs. The situation has been exacerbated by the recent passage of President Donald Trump's One Big Beautiful Bill, which includes funding cuts, a focus on waste, fraud, and abuse, and new work requirements for Medicaid recipients. Critics argue that these changes could result in millions more losing their health coverage, further exacerbating the problem. What to know? In California, the number of people enrolled in Medicaid peaked at 14,285,643 in March 2023. By March 2025, that number had dropped to 13,392,566, a decline of approximately 900,000. This decrease, while significant, is actually smaller than the reduction seen in other highly populated states like Texas, Florida, and New York. During the pandemic, many states expanded Medicaid coverage under the Affordable Care Act, ACA, leading to a surge in enrollment. Federal rules required states to keep most Medicaid enrollees on the program, even if their eligibility status changed, until March 2023. At that point, states were allowed to begin the process of reviewing and potentially removing beneficiaries from the program. Despite the decline, the number of people with Medicaid coverage in California in March 2025 was still 16% higher than pre-pandemic levels. However, the rate at which Medicaid coverage is unwinding varies significantly from state to state, depending on how each state approaches the eligibility review process. What people are saying. Michael Sparer, a professor and chair of the Department of Health Policy and Management at Columbia University, explained to Newsweek Medicaid enrollment surged during the pandemic due to increased unemployment and a federal mandate that states could not recertify beneficiary eligibility until the public health emergency ended. As a result, millions signed up during the pandemic, and their eligibility could only be reviewed starting in spring 2023. Sparer added, there is clear evidence that many beneficiaries who were still eligible lost coverage simply because they did not navigate the administrative hurdles to recertification in time. This is a serious issue as it can lead to bad health outcomes and should not happen. Additionally, those who are no longer eligible for Medicaid should be guided to other options, such as subsidized ACA marketplace coverage. The variation in how states handle these reviews creates unfortunate inequities. What happens next? As the unwinding process continues, more reductions in enrollment are expected in California and across the country. With millions already having lost health coverage, there are growing concerns about access to care for low-income individuals and families. And this is the part most people miss. The long-term impact of these changes could be profound, affecting not just the health of individuals, but the overall stability of the healthcare system. Is this article trustworthy? Newsweek is committed to journalism that is factual and fair. We value your input and encourage you to rate this article. Your feedback helps us improve our reporting and ensure that we continue to provide accurate and reliable information. About the writer. Jasmine Laws is a U.S. news reporter at Newsweek based in London, UK. Her primary focus is on health insurance, including Medicare and Medicaid, but she also covers U.S. politics, crime, and global affairs. Jasmine joined Newsweek in 2024 from News UK and has previously written for the Metro, Byline Times, The Human Perspective magazine, and The Express. She has extensive experience covering stories related to the UK art industry, human rights, health, and human trafficking. Jasmine was nominated for Best News Piece at the UK's Anti-Slavery Day 2023 Awards in Parliament. She is a graduate of Durham University and completed her NCTJ at News Associates. You can reach Jasmine by emailing jasmine.laws@newsweek.com. Languages: English.